So moving along here, so gestation for the listeners in terms of the health of the mother during gestation and how that's going to impact the child's health, both as a baby, and during birth, during uh, infant and weaning, toddler, and young adult.
Well, there's no question that a lean, fit mother who gains an appropriate amount of weight for a pregnancy has all kinds of wonderful things happen. Like usually they are able to have a normal birth, which means the baby went through the birth canal, which changes the baby's gut biome from day one. They are more likely to recover quickly and therefore be more successful at nursing, which changes the risk of all kinds of chronic diseases for their child and also reduces the risk of breast cancer for the mother. The overfed baby, that is the baby whose mother has insulin resistance during the pregnancy, is usually larger and therefore more likely to have a C-section, to be born by C-section. If the mother truly has out of control diabetes, there's a whole host of other complications. But we're just talking about the kid whose mom is insulin resistant, put on a little too much weight, and her glucose tolerance test wasn't normal, and she was called a gestational diabetic. This is a woman who probably has chronic insulin resistance, but the pregnancy tipped her over into something measurable. Though those babies are born bigger, they stay bigger, they have not all the right kinds of fat in all the right kinds of places. They're kind of cute and chubby when they're first born, but they often go on to be heavy children. And of course, again, we've got family eating habits that are probably not ideal. So in the best of all worlds, all women would start their pregnancies lean and fit, and then they would stay fit, and they would gain an appropriate amount of weight, but not too much. And they would, other than those first few weeks when you're barfing all the time and you eat anything that'll stay down, hopefully they'll maintain their pregnancy with high quality, nutrient-dense food that feeds their baby appropriately without popping their blood sugar up, and then causing the baby to put out too much insulin. A baby that's born to a diabetic mother is much more likely to have severe low blood sugar right after birth and need an IV, sometimes results in an ICU admission. Now that'll kill breastfeeding. So it's not ideal. And for women who are having twins, there's actually a growth chart for how much weight a woman should gain during a healthy twin pregnancy. It's not just free for all. Oh, I'm growing two now. Yes, you're growing two babies. You're going to gain more weight, but there is a table for a healthy gain, not a just, well, whatever happens, happens.
Well, and this is a big case for optimizing fat metabolism, because when you're growing a baby, you need lots of protein and fats, the fat-soluble vitamins, and you need that caloric and nutrient density, because protein, when people are all talking about protein, I'm just thinking, yeah, but what about the protein assimilation? Because, people have gotten in this thing about lean protein, and they need to have natural animal-based proteins with the fat that comes with it, like whole eggs, fatty cuts of meat.
Right. The skin
chicken
on the
with
meat,
the skin on it,
the chicken.
because
Yep.
because that's what assimilates the protein, is the fat with the protein is what mixes with the bile so that it can be taken up and assimilated properly. So this is where, because proteins assimilate through lipoproteins, right? And it's made in these cholesterol, in the cholesterol that's sent to, feed the baby and grow that baby, as well as support the mom.
You don't want to grow the baby and not nutritionally support the mom, but baby brains need lots of cholesterol. Lots. That's why breast milk is so fatty. It's got a lot of fat in it. I don't remember the proportions. It's obviously perfect for babies. Has a little bit of sugar.
Milk is the only food in that naturally occurs for mammals that's got high percentages of fat, protein, and carbs. Because
In
it's
exactly the
real
right
good
proportion.
at right, and it shift the profile shift between mammals, of course, but it's essentially the only food that exists that has all three, because most of your animal proteins is fat and protein, and most of your vegetables and things like that is just water and sugar or carbs and fiber, and so when you look at those pressures that shaped us, it's kind of like right there, but you got to pay attention.
Right. And anyway, so unfortunately, women who go into a pregnancy less than metabolically fit put themselves and their future children at risk of some immediate complications and some long-term complications. And it doesn't have to happen, but with the ongoing government recommendations for diet that dates back to the 60s, and it's been wrong ever since, people who are trying really hard to follow the guidelines are not doing all that well, actually, anywhere.